Welcome back to the show, Talk with Your Doc. And with me is Dr. Kurshal Dighe, and we are talking about coronary artery disease. Dr. Dighe, you were mentioning that sedentary lifestyle and smoking are the risk factors. And you mentioned that smoking causes damage to the lining of the heart as well as the diabetes and hypertension. And also sedentary lifestyle or less physical activity can also lead to coronary artery disease.
Right.
So what is the minimum physical activity recommended? Is there any time frame or how much activity or exercise I should be doing every day?
I mean, if you do exercise every day, the more is better, as I said.
Mm-hmm.
At least if you are able to do at least 30 minutes of exercise per day, that would be a best thing. Some people are quite busy in their lifestyle, so we say, at least if you do 5 times a week, that will be better. So you can choose weekdays versus weekends, but at least 30 minutes of physical activities, good amount of activities, as I say, enough to make you sweat, that would be good enough.
Right. I've heard that people who have a family history of heart disease, they have an increased incidence of coronary artery disease or heart disease or heart attacks. Can you please explain us more about it?
Family history is pretty much linked very much to the high cholesterol that they have. So either these patients have some genetic defects in their cholesterol metabolism that they are able to develop high amounts of cholesterol that leads to deposition of this cholesterol in the coronary arteries, or there is something that is beyond that. Even from what we can understand, they have some mechanisms other than which we don't know at this point, could be that they are more predisposed to the way their body reacts to certain stressful situations. But that part is still not so well studied. But what we know for sure is if a person has family history of heart disease, then they better see if their cholesterol is high. And that you can check at a little bit earlier age, maybe in their 30s or even early 40s.
Now, when you say about cholesterol, there are 2 types of cholesterol, good type and bad type. Can you please explain us how do we differentiate between these 2?
Sure. The good cholesterol is what we call as HDL, and it is cardioprotective. So the more amount of HDL cholesterol you have, less is the likelihood that you would have coronary artery disease.
So how do we get HDL cholesterol?
HDL cholesterol, there is no great medication to improve your HDL cholesterol. The biggest way that increase your HDL cholesterol would be exercise and activities.
So exercise converts bad into good?
You form more of good cholesterol as opposed to bad cholesterol.
Okay.
Yes.
And what is bad cholesterol?
So bad cholesterol is we call as is LDL, and it is pretty much related to dietary intake or to cardiac risk factors such as smoking, diabetes, and hypertension.
So what sort of diet contains this bad cholesterol?
So anything that is fatty, so if it is any diet that is too much oily or having too much of fatty tissue, or even you have these labels you can check and they will say this much cholesterol or this much amount of fats the person, the food has, the higher the amount, the more likely of that amount being deposited. Although I should say our body also makes cholesterol because you need some cholesterol for development of brain, for example, or development of certain tissues in your heart, in your body. So your body makes cholesterol as well. So as long as it's like a balance, as I said, so if you intake quite a bit, but you don't spend that much of calories doing physical activity, so overall there is a net gain at the end of the day, and that net gain you store in your body as fat.
As a bad cholesterol, that problem.
And that can cause bad cholesterol.
What is triglyceride level? I've seen many patients having high triglyceride level. So how do we get the triglycerides in our body?
So it's again the same way. It's dietary intake is a main factor for triglycerides. Also they have, as I said, there could be some genetic familial disorders that can increase your triglycerides. Again, I should say that high alcohol intake is a common reason for high triglycerides as well. Yes.
So does this high triglyceride and high quantity of bad cholesterol, they lead to this plaque formation in the vessels, right?
That is what is the current norm. So as there is damage to the inner lining of the heart arteries, there is progressive accumulation or deposition of cholesterol and fatty substances inside the lining of these arteries. Now, as they kind of the process, as I said, starts at a very early age. And as this process continues, later on, there's deposition of fibrous tissue, there's deposition of calcium, and this overall process we call as atherosclerosis.
Right.
And this doesn't just happen in the coronary arteries, but probably every artery in your body.
Now, when we buy the food from the market and we see cholesterol high or good cholesterol, bad cholesterol in it, and the contents of those, but no cholesterol is better or some good cholesterol is better?
So, it's very a marketing gimmick that the food industry makes is they put a big label of no cholesterol or low cholesterol or so on. But these products you have to check their labels because they may contain high amount of sugars. So overall, you are consuming, you're substituting one bad thing for another, and still it's not good for you. So the quantity also matters. So if you're having something that is low in cholesterol, but you consume twice the amount, then overall you're still having the same amount of cholesterol in your body.
Right. So we have to watch for how much quantity we are eating along with what we are eating.
Probably I should say we are eating more than what we need.
Now, obesity is one of the very important factor of the heart disease, and people who are overweight get a lot of heart disease. So can you please explain us what is the relationship between the obesity and heart disease?
So obesity is kind of again a factor where you're probably storing too many calories at the end of the day as opposed to burning them. So you're likely less active, you're likely consuming more calories than what you need. Likely you have higher risk, or probably you have also developed diabetes or hypertension because of obesity. So these are all similar interlinked factors to develop coronary artery disease.
Obesity is growing very rampantly in all over the world, probably because of the TV and television and computers and less physical activity.
Right.
So more physical activity would be preventive for the heart disease, probably.
Absolutely. So as I said, you should, before you put in some food into you should always think, how am I going to burn those calories?
Right. Think of output more than input then.
Absolutely.
Now, is diet related with the prevention of the coronary artery disease? Like if you eat more fruits and vegetables, does it change the possibility of getting heart disease?
Right. It could, yes, because you have certain factors in your diet that can be cardioprotective, or you have certain things that can increase your good cholesterol. So certainly eating more vegetarian diet or consuming less animal fat or consuming more fruits and vegetables will reduce your chances of coronary artery disease.
Thank you, Dr. Dighe. Please, we'll take a short break and we'll come back for the next part.
Sure.
Please stay back for the next part. Thank you.